Let's welcome in now Dr. Amesh Adalja. He is a senior scholar at the Johns Hopkins Center for Health Security. His work focuses on emerging infectious diseases and biosecurity. Doc, great to have you with us today.
Thanks for having me.
So let's talk about the spread in Africa. Just for example, when we look at the COVID pandemic, that was able to spread without any visible symptoms sometimes. But with Ebola, the spread comes when there are visible symptoms. Why is it taking the WHO so long to get a handle on this particular outbreak?
The reason the WHO is taking so long to get a handle on it is because it had been ongoing for probably a month or so before there was actually any official notification that this was an Ebola outbreak. So this basically spread unchecked, gained a lot of momentum, set up lots of chains of transmission before the WHO could actually bring any resources to bear. And that has to do with the fact that there were some failures in terms of they were checking for the most common species of Ebola, and this is caused by a more rare species of Ebola. And that follow-up testing didn't occur for some period of time, creating this major lag that's going to basically require months now to kind of contain this outbreak and make it much more harder to extinguish.
Well, you mentioned some failures. We still have Dr. Tedros in charge of the World Health Organization. He was also in charge of the organization during COVID. Is he the right man for the job?
I don't have any specific issue with Tedros. The failure was more about the way that test samples are run in the DRC rather than something that WHO could or couldn't do. This is, countries have to have some in-country capacity. And my understanding is that when these types of things test negative for an unknown cluster of illness, it has to get forwarded on for more sophisticated testing in Kinshasa, the capital of the DRC. That didn't happen, so it took some time. So it's not necessarily a WHO issue. I think they've been doing the best that they can do with that late notification, but it is something that really underscores the need for us getting better at being able to diagnose these things very early. We cannot let clusters of infectious diseases anywhere in the world, whether that's in New York City, whether that's in the middle of the United States, whether that's in the DRC, they can't go without diagnosis. We need to really use science and technology to catch these things as early as possible, proactively, so that they don't spiral into what we have now in the DRC.
Whether it's Ebola showing up here potentially in this country or something else, are we equipped to do what you just said right now?
So the issue has never been really a science, technology, medical problem. All of those tools exist, the tools that we need to master these infectious disease problems. What happens is that we don't have policies in place, or we don't have policymakers that do this when there's not a crisis. When this is in the headline, everyone is talking about Ebola or hantavirus or whatever it may be. But this is going to fade from the headlines, and so will the interest from policymakers. And they don't necessarily think of biosecurity and health security in the same vein as they do national security. And it goes through boom and bust, panic neglect cycles. And what we need is a proactive response that's doing stuff sort of during peacetime, just like we do with national security. And that's something that I've argued for a long time, that we need to become more resilient to infectious disease, or these disruptive things occur, and they cost much more to stop after they've expanded than when they're just very small outbreaks.
We hear from doctors that the risk of spread in the United States is very low, but at the same time, people wake up to new travel restrictions here in the country. What are you supposed to make of these?
Well, Ebola is it is a deadly disease. It's headline grabbing, but it's not very contagious. As you said earlier, you need to be symptomatic to spread it, and it spreads through blood and body fluids. It's not efficient the way a respiratory virus like COVID is. So this doesn't pose a risk to the general public. The thing with these travel restrictions, and I've never been in favor of travel restrictions, I favor targeted travel screening, like what you're seeing with those airports where people are being funneled in, is that politicians from all over the world will often jump to travel bans as the first thing they do because it makes them look like they're doing something. And sometimes these can be counterproductive because they make it not only people can't get out, it makes it hard to get resources in, and it discourages people from going in if they're going to be subject to travel bans. For example, if you're a doctor going there to volunteer, to help, and then you can't come back, that's going to disincentivize you. So this is something that has to be handled delicately, and it's not just the United States that has a travel ban. Now Canada has one, the Bahamas have one, Thailand has something similar. We saw the Ugandan border closed, the Rwandan border closed. This is what happens during these outbreaks, and this is kind of the lesson. If you're not proactive and these things get bigger, politicians are going to run for these blunt tools because they think they work, and they end up and prolonging this.
Well, yeah, I think there's still a hangover for a lot of Americans that remember the COVID era and how politicized that entire situation was. Politics is its own kind of contagion when it comes to solving these problems. And you hope that the people, the smartest people, are in the position to make the right decision, not necessarily the best politician. Doc, great getting your insight on this. Dr. Amesh Adalja, thank you so much.
Thanks.